In this video, we'll continue to discuss neurovascular bundles of the arm. In this instance, we will look at the venous and lymphatic drainage of the arm. Some relevant principles. V1, arteries supply a tissue or region of the body through their branches, and veins and lymphatics drain a tissue or region via their tributaries. Principle V3, arteries and veins are continuous throughout their course but tend to change their names according to what region of the body you are looking at or where they branch or receive tributaries respectively. And importantly for the lymphatic system, the body wall and limbs have both superficial and deep drainage systems in the venous and the lymphatic systems, and superficial lymphatic drainage follows veins, whereas deep lymphatic drainage follows arteries. So this is an image taken from the Moore textbook, and it shows the superficial venous drainage of the arm. Veins to note include the brachial, basilic and cephalic vein. So we'll identify on this image the basilic and the cephalic vein. The brachial vein is a deeper vein and would run paired alongside the brachial artery. So having a look at the image, we can see right down in the region of the hand, small beginning venous structures merging and draining to form tributaries and progressively becoming larger venous structures. So this is the beginning of the venous drainage of the arm, and depending on which side of the hand you're looking at, we can term this the superficial venous palmar arch or the dorsal venous network. So we start with small venous structures progressively draining in or providing tributaries to become larger venous structures, and we can identify the names: the cephalic vein on the lateral side or on the side of the thumb, and the basilic vein on the medial aspect of the forearm. The names for these two veins make more sense when you consider the initial embryonic position before the limbs rotate. Cephalic would be referring towards the head, whereas basilic is referring towards the base. So cephalic vein travelling along here in the groove in the deltoid muscle, and basilic vein following a more medial aspect of the arm. So that's the superficial venous drainage of the arm, and as I said earlier, the brachial vein is not shown on this image. It would run paired with the brachial artery. So considering now the superficial lymphatic drainage of the arm, superficial lymph vessels will tend to follow the superficial venous drainage that we've just discussed. So we should look for lymph vessels travelling along with the pathway of the cephalic vein and of the basilic vein that we've just identified. So lymph vessels that follow the some of the lymph vessels that follow the basilic vein drain into cubital lymph nodes, shown here. And considering the path of the cephalic vein and the lymph vessels that follow it, most of the lymph vessels following the cephalic vein will cross the arm to drain into axillary lymph nodes. However, some will drain into a different set of lymph nodes, the deltopectoral lymph nodes, shown for you here. So there's two patterns of what lymph nodes the lymph vessels following the cephalic vein will drain into. Most of them will go into the axillary ones, however a few will drain into the deltopectoral lymph nodes. Considering the deep lymphatic drainage of the arm, these deep lymph vessels will accompany the arteries and also the deep veins that are running alongside of the arteries. So the names of these vessels would include the radial artery and veins, ulnar artery and vein, and brachial artery and vein. So we can not see them on this image. It's again just a superficial diagram, but we would expect to find the radial artery and veins running along the lateral aspect, and the ulnar artery and veins running along the medial aspect shown here, and the brachial artery and vein would be right along the midline of the forearm. These will drain into humeral and axillary lymph nodes, and progressively these lymph nodes and lymph vessels will drain into the subclavian lymphatic tract and eventually back into the thoracic duct. And the pathway from the thoracic duct includes returning the lymph fluid itself to the junction of the left internal jugular and the left subclavian vein, and henceforth back into the heart and circulatory cardiovascular system. So as an activity, label the neurovascular structures in the arm compartment's transverse diagram that you can find in your subject manuals, and locate any visible vessels of the arm using a surface anatomy model or your own arm. We haven't shown you a model with the veins and lymphatics in this video, as they're usually not present on models of limbs. However, you may see them in the wet lab prac classes that you attend, and as always, post any questions on the relevant forum.